Assalamu alaikum. Good morning, everyone. My name is Dr. Jassim Al-Najada. I'm an R4 family resident and Kuwait Family Board family physician. I will be introducing our next speaker, Dr. Mohammad Alazemi. Dr. Mohammad Abdullah Alazemi is a public relation and media director in Ministry of Health, head of South Salabia PHC Center, president of Kuwait Association of Family Medicine and General Practitioners, president of the Gulf Association for Family Medicine, representative member of Kuwait and the World Organization of Family Doctors, WONCA EMR Council, Eastern Mediterranean region, who achieved the Bachelor of Medicine and Surgery from the Royal College of Surgeons in Ireland, a member of the Royal College of General Practitioners, MRCGP and Kuwait Family Medicine Board, a degree of MSc in Leadership and Management Development, Institute of Leadership, Royal College of Surgeons in Ireland, certified trainer from Oxford Leading Training Organization and DCOM from Consulting and Training, practitioner and coaching from ACSTH, International Federation of Coaches, the former president of the National Union of Kuwait Students in the UK and Ireland, Kuwait Award for Youth Innovation and Excellence in the field of health promotion, the owner of the Ideal Family Medicine Clinic project, which was implemented as a first appointment-based clinic and primarily healthcare centers in Kuwait, a TV presenter of weekly program Health Steps, Doctor's Talk, on Kuwait TV. Please, Dr. Mohammed, you have the floor. You can start. I think you need to open the mic, Dr. We can't hear your voice yet.
Yeah, can you hear me now? Yeah.
Yes, we can.
Yeah. Thank you so much, my dear, for this introduction, and I'm so glad to be here with you in this 8th review course. And I'd like to thank all the speakers from outside Kuwait, especially Dr. Khalid. Thank you so much for your lecture. Today, I'm going to talk about the approach to acute chronic abdominal pain. And usually my way in that, I don't like to just read the textbook and, you know, I'd like to be an exam oriented. I know you have now stressful time for your exam. I think smart يعني الشخص الذكي في الوقت الحالي هو اللي usually يكون عنده calm down ويركز على المعلومات اللي عنده ويبتدي step by step في هذا الموضوع. Abdominal pain is extremely important topic. Usually, especially the acute abdominal pain and the chronic abdominal pain, usually you have to understand everything here. You have to understand how can you approach to the abdominal pain, either acute or chronic, and you have to understand the approach system exactly. Today, my lecture, I'm not going to talk about specific differential diagnosis, because I think all of this information, you can find it in the textbook. You can find it in Oxford textbook, for example, for the acute, for the emergency. And you can find it in many sources. But I need you to understand the approach. And if you understand the approach, this will be very helpful for you, especially in your clinic, when you meet the patient, and also in the exam. Okay, so here is the I want to just focus on the most important questions or the high yield questions for that. Usually concentrate on the age, guys. Increased age in any patient came with abdominal pain is usually, we consider that as a higher risk. Okay, so increased age is a higher risk. Which came first, the pain or vomiting? Usually, if the pain came first, this is a surgical cause. So you have to think about that. Okay, so how long did you have the pain? It's acute or chronic? So this is also very important questions you have to think about it. Surgical history, if the patient have any previously opened abdomen or any surgical before, is the pain is constant or comes and goes? Usually constant pain is the worst. Do you have any past medical history of immunocompromised, pancreatitis, cancers, or IBD? All of these things usually suggest serious causes. Pregnancy, don't forget pregnancy, because all my colleagues in my in my batch in 2015, usually we forget pregnancy on all the abdominal pain questions and even in the long cases. So pregnancy, guys, if the female came to you to just with abdominal pain, just think about pregnancy, and please don't ask this question for male. So childbearing age, usually ectopic pregnancy is very important as well. As I told you, usually recent of antibiotic or steroid, and this is also usually they bring that questions like with the tricky questions for the exam. So usually steroid, guys, and antibiotic usually may mask the serious conditions. Okay, so just consider that in your mind. Past medical history of heart disease, vascular disease, AFib, all of this can be serious causes of concentric ischemia. I think this is the most important. This is the first tool that you have to take it to approach the abdominal pain. The Socrates questions is extremely important, and I think I think you have, guys, to understand every single letter in this slide. So you have to ask about the site of the pain, the Socrates question, the site of the pain. So you have to ask the patient, first of all, where is the pain? Usually use open questions rather than closed questions in the beginning of the abdominal pain. Don't usually, ask the closed questions, because you will miss a lot of information. So if I have the patient now, so I will ask him, where is the pain? Can you tell me more about this pain? This is the open questions thing. Then you have to ask about the Socrates questions, the specific questions about that. So the site. So can you point the pain with one finger? You have to allocate the pain. You have to ask about the onset. When did the pain start? The character. Explain. What do you feel? شنو قاعد تحس فيه؟ هل هو مثل السكاكين اللي قاعد تغزز فيك؟ هل هو مثل الحرقان؟ You have to يعني ask specific questions about the character, because it will affect and it will guide you to the correct guidelines. Radiation is extremely important as well. So does the pain radiate to anywhere else? Many diagnoses with abdominal pain can radiate it to different part of the body. Usually I take the associated symptoms in the last of my questions. So I ignore it in this time. And I will ask you, I will tell you why I ignored the associated symptoms in this stage. Then we can ask about the time. When did the pain start? Has the pain changed? يعني هل هو بلش سهل بعدين صار عندك أصعب البين؟ هل you have to understand everything about the duration of the symptom. Then this is also the relieving factors, the affecting factors of the pain. So هل أنت قاعد تلاحظ إن في أي عناصر ممكن إنها تزيد من العوار اللي موجود وياك؟ هل إذا كليت قاعد يزيد العوار اللي وياك؟ هل إذا كليت قاعد يروح العوار اللي وياك؟
Dr. Mohammed, excuse me, if it's possible for the lecture to be in English, so everyone would
of course. Yeah, okay.
Much appreciated.
Okay, so you have to ask all of these questions, especially the relieving factors and the affecting factors about the pain. The severity is very important. Also, on a scale 1 of 10, 10 is the worst pain you have been experienced. So how would you grade this pain for me? You have to explain this to the patient, and you have to explain since the pain come to you, how would you score this pain for me in the beginning and then now? And if you see if the pain is going up in severity, so this is a serious mark, or you have to consider that as an important. Then the associated symptoms. Usually I ask the associated symptoms on the last of the Socrates, because then at this moment you understand everything about the pain, the site of the pain, the onset, the character, the radiation. Then the associated symptoms, it will guide you to the different differential diagnosis. And this slide is extremely also important about the differential diagnosis about the abdominal pain. So you have to consider that, and you have, even if any patient come to you, you have to consider the site of the pain, because this is one of the most important like tool to guide you to the correct differential diagnosis. So you have to understand this slide. So if the patient asks you about the pain in the epigastric pain, so you have to consider gastritis, peptic ulcer, pancreatitis, and MI, for example. Usually, guys, the abdominal pain, usually we have an extra, you know, or different site of the different differential diagnosis, not usually caused by the abdomen. Like as I told you before, the ectopic pregnancy, for pregnancy, MI, in cardiology, pneumonia, and respiratory. We have many different things you can think about it when the patient come to you with abdominal pain. Then when you finish the history of the full history of the of abdominal pain, when you ask about the associated symptoms, and then you have your differential diagnosis, then you go directly to the past medical history, past surgical history, the medication, and etc. It is very easy for you to do that. I'm not going to concentrate on this. Then you have to do the examination. The examination, guys, also it's very simple tools, and I think it's extremely important, especially in the Kuwaiti Family Medicine Board, because they usually bring something about the abdomen, either by history or examination or some lab investigation. So, but examination is also extremely important on that time, and it's very easy, by the way. So you usually it's very easy things. Usually think about the 4 concepts of the examination, which is the inspection, the palpation, percussion, and auscultations. Don't forget in any examination, and especially the abdomen examination, to ask first of all about the BMI, the weight. You have to ask the patient to weight the patient, because this is extremely important, and we usually miss this in most of our examinations session or station in the exam. So I recommend here to see the geeky videos in YouTube, and I think it's very simple and very easy to recognize it. Usually in examination, guys, you have to be a good actor. You have to show the examiner that you are doing the examination, and be empathy and sympathy. And usually what I do and what I did before, usually, to be honest, I treat the patient, I treat the actor which is in front of me as a real patient. And when you just do that, you will feel comfortable, and you will show your empathy, sympathy, your eye contact, you will choose nice word to the patient, and you will address and just deal with the patient in the OSCE examination as a patient. يعني why you usually you are doctor now, so you treat as a doctor and patient, and don't usually assume that this is an OSCE examination. And this actually I found when I did like that, I found that I did very well in the examination, and I got a lot of marks on that. Guys, the management is very important here. When you do the examination, so usually either in the OSCE examination, sometimes they will ask you, how would you manage this patient? Or in the real case, in the long case for the R5 patient, usually you have to understand every single word in this slide as well. The management, the RAPROYOB approach. Have you ever heard about that? So if not, you have to start train yourself, because this is a skills you can develop over years and years. And when you reach R5, you will have in every single consultation, you have to use RAPROYOB for management to not forget any aspect of management when you have the consultation. So RAPROYOB usually start with reassurance and explanation, and this is very important. I will just go through it. So you have to reassure the patient and explain to the patient what happened. You have to give the patient advices. You have the P for prescriptions. So you have to prescribe the patient the medication. You have to refer the patient if the patient needs referral or not, investigations, observations and follow-ups, and prevention and health promotion. So you have to cover all of these aspects about your patients. So reassurance, what usually يعني think about the reassurance and explanation. Usually you have guys, here is the power of the family medicine. Here's in this point, you will show the power of yourself, the power of family physician rather than other subspecialties. For example, we usually treat the patients in 3 different aspects: about the social factors, about the psychological factors, about the medical factors. Here will be the difference between a good doctor and not a good doctor. How you communicate with your patient, how can you be you show your empathy and your sympathy about the patient, how can you explain to the patient what happened to him, what the options that the patient have. Here's, I think, in the management, and usually if you are very good in reassurance and explanation, this will increase your mark in the examination, and this will affect all the other sections below the reassurance and explanation, which is the advices and prescription. So you have to reassure the patient. You have to use simple words. You have to use simple words, not complicated words. You have to use for example, you can explain to the patient by drawing something for him. You have to bring some papers with you to draw, to give the patient 2 arrows, for example. Usually use the skills which is can make life easier for the patient, make the patient think in very or receive the information in a good way. So this is the reassurance, actually. So you have, as I told you, you have to show your empathy and sympathy to address the patient anxiety and worries, to be very simple with the patient. And here, actually, many different books can talk about this type of the communication skills and that section. And I think when you start, and this is my message for R0 doctors, R1 doctors, R2 doctors, start now to think about that, and usually use the RAPROYOB for all your patients since now until the R5 and until your graduation. The explanation actually is usually the reassurance and explanation usually is linked together. So you have to explain to the patient, you have to give the patient all to address all the worries about the patient. Advices is extremely important as well. Guys, don't forget to, this is usually, I usually use the advices in many different ways. Don't forget, guys, to advise the patient. Anything that have been told in the consultation about, for example, smoking, alcohol, overweight, anything like that, you have to now reflect that on the advices at the end of the consultation. So you have to usually, don't forget to advise the patient about the sleep. sleeping pattern about the patient. Sometimes don't forget to ask the patient to advise the patient about smoking cessation, alcohol, stop alcohol drinking, especially for the abdominal, if this affect the liver diseases or anything in the abdomen that can يعني الكحول can make this worse. Don't forget to about the lifestyle, to do some weight loss, to increase the food, the vegetables and fruits intake, healthy food, stress reliever, everything in the advices. You have to take this very important to your patient. Prescription is very important as well. So when you reach this this level, you have to give the patient the medication. So what's the medication? What's the dose of the medication? How can the patient take this medicine? What's the patient here, when you give him the medication, he might ask you, what's the side effect, doctor, for that? Any contraindication for that? Doctor, I for example, I take this medicine. Can this medicine interact with that medicine that you want to prescribe it for me? And etc. So you have to be prepare yourself about the most important medicine, especially in the abdomen. For example, the antibiotic. If you give the patient the antibiotic for that, so you have to explain to the patient how can he take this antibiotic, after food, before food, the time, the duration, how many times, the side effect of that. And remember that there is an interaction with antibiotic with other medication, for example, the statin, for example, or other things. You have to consider that on your mind. Okay. Referral, I think referral is very important here, and the second R is for referral. So do the patient need a referral? The referral, it's two type of referral you have. You have internal referral inside the BHC or outside referral. And you need to explain the patient. So if I want to refer the patients for consultant in the room beside me, so I can do it in the center, in the social services, or other services outside the BHC. We usually ask yourself about why do we need to refer the patient. Usually we need to refer a patient for second opinion, for example, for diagnosis, if you don't have the diagnosis, for investigations, if the investigation is not ready in your center, for emergency treatment. Also, if the patient needs some therapy, some social reasons, and in response to patient pressure. And don't use this too much. We fight about the patient pressure. If the patient want to get the referral and the patient don't need the referral, please don't do that. Explain now in this situation, explain to the patient, reassure the patient. Usually use your communication skills to address this problem. Investigation. So we need to do most of the abdominal pain problems. We need an investigation to do it, especially celiac disease, for example. Even the appendicitis, even everything, I think, in the abdomen need to do some investigation. So, but usually, please ask all of these questions to yourself. Why I'm ordering this test? What I'm going to look for it in the result? If I find it, will it affect my diagnosis? How will this affect my management? And is there any benefit for the patient for that? So usually, you guys, now I'm working in the management level, but before that, and I saw the statistics about that, there is a lot of unnecessary investigations done in the BHC, and this is unaccepted, to be honest. And you have to think about that. Sometimes it's harmful for patients, sometimes it's harmful for our system, and abusing the system and abusing the cost in this country. So just
Dr. Mohammed, I think your voice just cut.
Up to the specific يعني we sorry guys. Hello. Hi.
Back, Dr. Mohammed. Yes, you're back now. Your
Okay.
voice got disconnected on the few sentences you mentioned last.
Okay. So now about the observations and the follow-up, as I told you before, you have to they give the patient close follow-up or open
Dr.
follow-up.
Mohammed, if it's possible to share your screen again, because it got disconnected.
Okay.
Yes, thank you.
So you have to sometimes you need to give the patient close follow-up or open follow-up. What I mean in the close follow-up is to give a specific date for the patient to see the patient. And for example, if you give the patient antibiotic for some reason, so you give the patient close follow-up to see the patient after 1 week to see the improvement of the condition, or open follow-up. So you will guide the patient if you have this problem, if you have this complication about the disease, if you have 1, 2, 3 things, so you have to come to me directly. So you will give the patient to address the patient about the emergency, for example, to give the patient the red flag. If the red flag comes to you, please come directly to see me or go to the emergency department. The last thing about the prevention actually, and health promotion. And this is actually, guys, this is also the role of family medicine. We need to prevent the disease before the disease comes to real. We usually don't like to treat the patient. We need to prevent the disease to come to the patient first. So here is also the power of the family medicine to give the patient the prevention and health promotion advices about for example, here is vaccinations. You'll give the screening programs and etc. So this is the last of my presentation. What I told you guys in this presentation and my key messages in that, please, especially for the abdominal pain, please, when you see the patient, please feel as this is a real patient, not an actor in the OSCE or in the final examination. You have to ask all the Socrates questions about the history of the patient. When you do the examination, please don't forget the 4 concepts of examinations, and don't forget to ask to get the weight and the BMI for the patient for every single patient. In the history, if the patient is female, please don't forget to ask about the pregnancy, the last menstrual period, if there is anything like this, because we usually miss this information in the history. When you do the management, please do the approach, RAP-REOP approach. Understand it from now. Take a lot of sessions at skills. It's a skills you can develop, but if you develop in that time in the R1, R2, R3, you will be very happy at R5 when you reach the final exam for the board. So best of luck about that in your R2, R5 examination. And if you want anything, please don't hesitate to just contact us, contact your colleagues who passed the exam recently, and best of luck, inshallah.
Thank you, Dr. Mohammed, for sharing your expertise and this lecture with us. There is only one question in the chat or in the question section. So what is the type of pain that mesenteric ischemia present with? This question was mentioned by one of the audience. So if it's possible to either answer it through the question section, otherwise we'll move on to our break. Our break will be until 12:45. So we have an hour and 5 minutes from now. Thank you very much for your listening.